Why does diarrhea cause whole body paralysis? Now, this is one of the most high yield concepts that will be tested on the USMLE. So let me break it down. I'll ask you first, watching this, what's the most common infectious trigger for this diarrhea that causes whole body paralysis? And what does it have on its surface that causes the problem? Because if you understand that, this whole thing will make perfect sense. So the infectious trigger is generally a bacteria called as Campylobacter jejuni, and it has lipo-oligosaccharides on its surface that look structurally identical to gangliosides on your peripheral nerve myelin. So when your immune system makes antibodies against Campylobacter, those same antibodies can attack your own nerves because the targets look exactly the same. Your immune system is now confused and starts destroying myelin it was never supposed to touch. This is called as molecular mimicry, and it leads to a syndrome called as Guillain-Barré syndrome. So how does Guillain-Barré syndrome present? On the USMLE, they'll give you a patient who had a GI illness a few weeks ago, and now after a few weeks, they have symmetric weakness, starting in the legs, climbing upwards towards the thigh, trunk, arms, and if it keeps going, the diaphragm. The weakness is flaccid with absent reflexes because it is a lower motor neuron problem, and about 30% of these patients will need mechanical ventilation because of diaphragmatic weakness. So how do you test for this? The answer is lumbar puncture, which shows albuminocytologic dissociation, which means high protein but normal cell count, because inflamed nerve roots leak protein, but there is no CNS infection. Now here's a trap that you need to avoid. Steroids do not work for this condition even though it is autoimmune. The answer to treat it is IVIG or plasmapheresis, and if forced vital capacity drops below 20 ml per kilogram, you intubate before they crash.